Good evening, everyone. On this Thanksgiving, 90,000 people in Idaho are grateful for having health insurance for the first time in their lives. But your Health Idaho says 78,000 Idahoans do not qualify for insurance. The state has chosen not to expand Medicaid like 30 other states have done, so thousands of people fall through the cracks in the gem state and can't afford insurance. Tonight, Carol Honas puts a face on one of those statistics.
This gal will love it. Okay.
Several years ago, Suzanne Judd and her husband decided to leave their home and their job in Minnesota to be closer to their children and grandchildren in Idaho. Suzanne started a seamstress business in Pocatello.
Well, this bride wants us to check the rosettes. Now, I don't know, 500 of them?
Oh yeah, at least. And her husband works 20 hours a week as a consultant engineer for his Minnesota employer. Though they put in long hours in the new business, they have not been able to make any money yet. They're considered part of Idaho's working poor.
And we applied for Obamacare, and we were told that we didn't make enough money for Obamacare, that we were too poor. We were too young for Medicare.
And they couldn't get Medicaid because they fall into the category that would be covered by expanded Medicaid, and Idaho doesn't have that because Idaho lawmakers won't approve it.
There was nothing we could do. And within 30 days of applying, I was rushed to the hospital in an ambulance. Turned out to be a kidney stone.
That's typical. That's when I talk about it'll always be a matter of when, never if, when you need insurance. And her story is not unique. I hear story after story after story of someone who's in the gap.
Stephen Waig is the director of the Health Insurance Exchange in Idaho, and he says if the state would expand Medicaid, people like Suzanne would have affordable insurance instead of huge medical bills.
If she lived in the state of Washington, she would have it. If she lived in the state of Oregon, she would have it. If Medicaid in Montana is implementing it this year.
Thousands and thousands of dollars, which we're trying to do little payment plans here and there. Some of them aren't happy with that.
50% of the bankruptcies are medical bankruptcies. So time and again we hear, I can't afford to do this, so I will delay care. I won't get the care I need. End result is the condition gets worse. The end result is you may end up in the emergency room.
Waig says Suzanne's insurance woes and 78,000 other Idahoans in the gap would have affordable insurance if Idaho's lawmakers would agree to expand Medicaid like 30 other states have done.
You would think that Suzanne and her family would encourage their lawmakers to vote and expand Medicaid in Idaho, but surprisingly, she does not. Coming up in our next half hour on Newsline, she explains why her experiences in Minnesota make her hesitate to see Idaho take on expanded Medicaid. She believes it can ruin a state and increase taxes.